Hello, good morning. This is Dr. Łukasz Zadrożny again from Poland. Last week I was presenting a case where I use a digital guide to place a narrow implant in a narrow interdental spaces. Then we were using one MS kit, and today I will show you a different case, the case where I go guided to make a sinus lift procedure with implant placement, crestal approach sinus lift, which is very, very nice approach. Nothing more happened in my life since last week, so I'm the same guy who presented a case last week, and I'm still very happy to be a part of OSSTEM AIC Europe to present my experience with you. Like I mentioned, last week we were talking about one MS kit, this small one, and today I'm going to show you a case where I make a sinus lift surgery guided with a CAS kit, which is a very nice kit invented to make guided sinus lift surgeries. The kit itself is something like a combination of features of CAS kit, so crestal approach sinus kit, and one guide, which is a kit for guided surgeries. And actually, I really like the first one, the CAS kit, and of course I like one guide too. But CAS kit is on the market quite long, and I think I had the first CAS kit in 2011, so it's almost 10 years now, and I like it so much, and I use it in a very, very different cases, like delayed implantation, immediate implantation, combined with sinus lift, and many others. In general, the CAS kit contains drills with a very safe tip. With this tip, you can go just under the Schneiderian membrane, and using a stopper, which are in the kit, you can go very, very close under the sinus, and then you can put a special rubber connected with the rubber valve connected with the tube, and with a syringe with saline, and with this you can elevate the Schneiderian membrane. So it is very, very nice. I don't know why movie doesn't work now. It starts, and have a look. That's the two teeth extracted, and delayed side. You see the approach through the crest, and the sinus membrane is actually floating when the patient is breathing. This is another case of CAS kit. It's immediate after extraction of molar, and you can see here also that during breathing the membrane is moving. It's not destroyed, it's not tear, it's completely safe. And after placing this device connected with the syringe with water, sterile saline, you can inject the water with some pressure, and this fluid pressure will elevate your membrane without putting any metal instruments to the sinus. I found it very useful, and it works really nice in my hands, so I did many cases with this kit. And I'm showing what I'm doing from for example, the initial situation with casket, very difficult case. We can extract tooth, elevate the membrane, and we can put the implant with a very nice stability, and then we can have a very nice. Actually, this was the stability initially, and then we can observe the nice healing. We can observe very nice soft tissue contour, and again, very good stability, and then the reconstruction. Maybe only the abutment here could be better, but I'm not responsible for prosthodontics always. So anyway, the surgical part is mine. And just as introduction, CAS kit, so Crestal Approach Sinus kit, introduced initially as a manual kit, now is combined with one guide and available to make this kind of procedures guided. My first study published with CAS kit was 2014. Unfortunately, it's published in Polish, but the summary, some sentences from summary is like the sinus lift surgery is one of the most frequent, and the patient wants to have it done very low invasive and wants to have fast results. So I think it's very nice to have this in your hands. It was published in third number in 2014, the Polish edition of Implants, International Magazine of Oral Implantology, published by Dental Tribune. And so you can go to this study and just see the pictures if you don't understand Polish. But I'm during the preparation of another studies to be published in English, so hopefully soon we will have it published. Anyway, the idea of this Crestal Approach Sinus is combination of special drill design and stoppers. So we have a design of the drill tip, and we have similar stoppers, but in CAS kit we are focusing on the remain bone high, and we using appropriate stopper to go step by step up to the floor of the sinus. And what we changed with OneCAS is, because we are using the guide, which has a particular offset here, which is 10.5, like in one guide. So we are not using only the bone height, but we are adding all the distance from the top of the guide to the floor of the sinus. And we are using different stoppers just to go very, very close. First, let's say 1 millimeter shorter than the floor, and then we can protrude to the sinus with another 1 millimeter more stopper. And it looks like that on the drills, depending on the remaining bone height, like here, or there, you choose proper stopper just to be very secure on high, not to drill directly through the sinus, to not destroy the Schneiderian membrane, but just go very, very close and then protrude, maybe sometimes with a very slow speed. Anyway, in a kit you have different lengths of drill, 7 and 10 millimeters, and different stoppers, and you're choosing the stopper depending on the remaining bone height. And after drilling, you put this hydraulic lifting device, and you just press the fluid, and it goes under the Schneiderian membrane, and this fluid flows even under the Schneiderian membrane and elevate it, and then you can put the bone graft material. And actually, as you can see here, there is no guide at this point. It's no guide. Guide is during the drilling, and guide is during the implant placement. But I somewhere here have some new devices, and also this rubber stopper, and also this device to apply the bone graft will be available also to be used through the guide. So very, very good accuracy. So this is the accuracy for the going under the membrane. This this point from the guide surface to the floor of the sinus, and this is to position the implant. So you go very, very good in three-dimensional evaluation of implant position. And as all guides, this also starts from gathering the CT data, this one with some artifacts, as you can see here. Also combining with intraoral scans, or in my case, mostly it's like I take the just standard impression and send it to the lab to make it scan, and they prepare me the STL files, which I'm combining with the CT. Then I will design the prosthetic works or temporary sometimes, and according to the position of this prosthetic works, I'm positioning my implants. And in this particular case, we have the situation, we have to extract the first premolar. This is number 1-4. This is number 1-5, which actually patient prefers to have only the 3 implants instead of 4 if it's possible. And because we have a nice stability in 1-4 and also 1-6 and 1-7, we resign from number 1-5. And the best would be to have 4, but actually we finished with 3, and I believe that will be also very nice. So in this case here, in this position, actually we protrude to the sinus very, very small. But in this position, like first molar and second molar, we protrude a little bit more, and we elevate the sinus membrane just to put the implants on a proper depth. So it looks like that. So first drilling, number 1, then we elevate the sinus with the fluid, apply some bone graft, and again go back with the guide and place implants in the fourth step. So to make it faster, the designing process went like that, and I designed the guide for 4 implants, but one was like accessory. If the stability initially will be not ideal, we will put 4 implants, but we finished with 3. And as I mentioned, the offset, so the distance from that point to the neck of the implant actually later is 10.5 millimeter. And the tube hole here is 5. And it's for implants like 4.5 distally and 4.0 in a mesial position. And with this guide, we started the surgery, and it looks something like that. So guide kit, initial situation, anesthesia, and first we had to extract the tooth, and it was actually connected with some level crown. So first I removed the broken crown, and then I sectioned the root to remove it very, very careful. So I used some elevators to that, clean very carefully. Then I made a crestal incision, switched a little bit palatally, and opened the flap. I also have to clean the surface of the bone. After that, I put the guide on the patient teeth, and you can see also the windows just to check if the positioning is correct. And then step by step, I went through the drilling procedures with appropriate stoppers. And as you can see here, in some cases or in initial drilling, I can use the shorter drill, so 7 mm, and then do it even without stoppers. But now I'm going to proceed deeper, and I put the drill of 10 mm length and attached some stoppers just to be very, very close to the sinus. And we are changing the stoppers for shorter, just to go closer and closer, and finally we are going into the sinus. Of course, we are checking with the special probe if we already are in the sinus or not. Then we apply the rubber valve with the tube, and we try to elevate the sinus. If the connection to the sinus is not prepared already enough, we can go back with drilling and make the drilling a little bit deeper. But it's better to check initially, even if not full opening to the sinus happen. You can start to try elevate, and if it doesn't work, you can always make the osteotomy deeper. Here you see the application of the bone graft, and it's a very nice device. This you can see here. You just need to rinse a graft a little bit, and then through this device you can easily put the bone graft directly into the sinus. Actually, I add a little bit more now as a finishing, and now the implant placement also through the guide. Here you can see also the bars which I'm using to stabilize the guide on the patient teeth. I like to place implants with a handpiece, and because we have mounted implants, we have to exchange the driver, and initial placement is always on the handpiece, but finally we can go with the ratchet and finish. And I think it's very, very good that OneGuide and OneCAS is open to place implants, let's say more or deeper, if you decide to go a little bit more subcrestal, because the accuracy of CBCT is still sometimes a little bit different where you're watching CBCT and then clinically, and sometimes you just need to go a little bit deeper. As you can see, the initial stability is about 75, 77, 76 ISQ, so it's really, really nice. After placement of implant, I just use a bone profiler to create a nice profile of the bone. Actually, if we did the fourth implant, probably we will not need to do this osteotomies or some profiling of the bone, because the another implant would be in between and the bone contour would be a little bit different. But in case like this, when we put only 3, we need to make a little bit flatter the spot in between implants. Nylon suturing, this is IGAS, this is 5-0, and it was a surgery done with one of participants of my courses. We had a course of one guide, OneCAS, and in general about dental guided surgeries. And one of participants after the course decided to invite me to his office, and we did it in another city. You see, this is the picture just after the surgery. The medial implant is placed immediately with nice stability, and 2 distal implants are placed with the sinus lift made with the guide. So the procedure was done like I mentioned before. So first the drilling, then lifting and bone graft application, and then implant placement. So in general, we can be sure the positioning of the implants in 3-dimensional. So when we have the crowns later, probably that would be bridge like that, we will have nicely designed position to have a good restoration for this patient. And as I mentioned, it was done in another city. The doctor was very happy after the surgery, but it was done just before the crazy time we have now. So we don't have the control X-rays. And as you can see at the peak of the movie, I'm combining different techniques. So in this case, you can see guided surgery, guided lift, guided sinus lift, but also combined with immediate implantation and extraction. And I really like this kind of combination. I often do the cases like that, like here, where one was immediate, then I do the ridge splitting, and at the very back I also make a sinus lift. So I'm combining different kits. Here is asset, classic CAS kit, and taper kit, or here is even older GS kit, osteotomes or bone spreaders, and different techniques. I call this approach like a multi-goal approach, because at one surgery I'm always trying to make reach a few goals. So hopefully I will be able to speak more about this multi-goal approach in implant dentistry if we are able to organize this great meeting in London. But for now, I think I presented another case and another application where you can use guide, and hope you will find it interesting. I will try to organize and prepare another cases to share with you soon. But today, thank you so much for your attention, and have a nice rest of the day, and stay care. Bye bye.